Coronavirus has hit countries around the world, sparking public health emergencies in places as different from one another as Iran, Italy, China, and the United States. Markets are in turmoil, and companies of all sizes have been hit hard by the virus, especially those that do business in areas affected by the outbreak.
Respirator face masks has sparked a global race to fulfill those orders.
Ramp up manufacturing of so-called N95 respirator face masks.
Supplies of face masks are running short all over the world, leading to evidence of price gouging, empty shelves in stores, and fears among medical professionals that masks needed for surgery and treatment will run out. The World Health Organization warned on March 3rd that severe and mounting disruption to the global supply of personal protective equipment caused by rising demand, panic buying, hoarding, and misuse is putting lives at risk from the new coronavirus and other infectious diseases. The WHO estimated the industry needed to boost manufacturing capacity by 40% to meet demand for personal protective equipment, including masks.
We've increased, almost doubled our output from 19 million respirators to 35 million a month.
Especially noteworthy has been a type of mask called the N95 respirator. The N95 designation means that the mask is capable of filtering out 95% of airborne particles, including bacteria. That has placed leading respirator maker and American industrial giant 3M right at the center of the crisis, at a time when 3M is facing its own difficulties and its stock has had its worst run in decades. The spread of the coronavirus threatens the company's operations around the world, and eyes everywhere are watching to see whether 3M and other large makers of health and safety equipment can meet the soaring demand spurred by the pandemic. As of early 2020, the company was scrambling to ramp up respirator production as masks disappeared from stores and medical professionals worried about accessing sufficient supply to handle the deluge of coronavirus patients on top of those suffering from other medical issues. Global demand for supplies used to help protect people and to prevent the spread of illness, such as respirators, is currently exceeding supply, 3M told CNBC on March 10th. The company said it has increased its production at manufacturing facilities around the world, including the US, Asia, and Europe. It also said it was closely monitoring and responding to any potential impact on its broader supply chain. 3M was already supplying masks to other crisis-affected areas around the world at the time the coronavirus cases began appearing in China.
When we first started hearing about the different diseases in China, hearing there were some strange cases, we were working with Australia already to respond to the wildfires, and there had just been a volcanic eruption in the Philippines. So we were working with those countries to try and get them respirators as they needed it. As soon as we started hearing that there were a few cases in China, we realized that this could be a big event, and we communicated with the plants very quickly to start ramping up production.
In late March, 3M said it doubled global output of N95 respirators to more than 1 billion annually since the outbreak, and it plans to double that again over 12 months to 2 billion. The company said more than 90% of those were designated for healthcare workers, with the rest going to other critical industries, including energy, food, and pharmaceutical companies. Other mask manufacturers have also reported surges in demand in China, Europe, and North America. Honeywell said it has sold 20 million masks in China since the virus first emerged. In late February, Vice President Mike Pence said the government had contracted with 3M to produce more face masks and would be working with other manufacturers. U.S. officials said in early March there were only about 35 million medical-grade N95 facial masks available in the country. That was 1% of the 3.5 billion the country needs now that the outbreak has grown into a full-blown pandemic. The United States Department of Health and Human Services said on March 4th it plans to purchase 500 million N95 respirators over the next 18 months for the Strategic National Stockpile, which is a reservoir of pharmaceuticals and medical supplies that can be used when local supplies run out during a public health emergency. Brick and mortar retailers are seeing shortages of respirators and all types of masks, including several varieties health officials say are not especially effective against the virus. The World Health Organization said on March 3rd that prices of surgical masks had seen a 6-fold increase, while prices of N95 respirators had tripled. One Amazon listing for a 20-pack of 3M N95 masks climbed in price from less than $20 in December 2019 to nearly $200 in early March, according to online price tracker Keepa. 3M said it began running its U.S. respirator factories at full capacity as soon as it began hearing about the virus in China. Meanwhile, many health officials warned that many masks are of dubious use to ordinary citizens who in many cases are buying masks that don't protect against viruses or are wearing the right kind of mask the wrong way. In late February, the Surgeon General of the United States scolded consumers for buying up several types of masks which he said did not protect against the virus and threatened to deplete supplies needed by healthcare professionals. 3M faces the effects of the coronavirus at a time when it is facing challenges on several fronts. Shares of the company are on their worst streak since the Asian financial crisis of the late 1990s. As of March 26, 2020, shares of 3M had fallen more than 35% in the past 12 months. Sales grew modestly in the last quarter of 2019 after falling in each of the previous 5 year-over-year. In a research note in late February, Melius Research said 3M is arguably the most out of favor of the multi-industrial names, just 10% of analysts with a buy rating versus 44% for our average name. The company is facing several challenges. First, it is dealing with lawsuits and other fallout from its use of PFAS, or polyfluoroalkyl substances, which it and other chemical and materials companies have at times used in some of their products. 3M has used PFAS to make firefighting foam and its well-known Scotchgard product. The Centers for Disease Control and Prevention said PFAS may interfere with the body's natural hormones, increase cholesterol levels, affect the immune system, and increase the risk of some cancers. 3M told CNBC, research has only established that such substances are associated with certain health effects. It has not determined that these substances actually cause adverse health consequences. 3M has phased out the manufacture of some PFAS substances, but continues to use others in some of its products. Gordon Haskett analyst John Inch estimates 3M faces liability costs of about $14.5 billion associated with PFAS. Other challenges loom. Some Wall Street analysts say a recent downturn in the Chinese economy stands to hurt 3M considerably, especially through its businesses in the automotive and electronics sectors. China represented about 10% of 3M's sales and earnings in 2019, according to William Blair. China's already slowing economy has been exacerbated by the spread of the virus. The odd thing is that while coronavirus stands to harm 3M's businesses in China and elsewhere in the world, the company will also receive a boost from the sales of its respirator masks, which are in high demand in China and the US. Both 3M and Honeywell are leading producers of the masks in China, according to William Blair. On March 24th, U.S. automaker Ford said it would work with 3M and GE Healthcare to produce masks, ventilators, and other equipment.
We are focused a lot on respirators in our company, but it's more than that. We're working on ramping up additional capacity for hand sanitizers, for disinfectant capabilities. We're working in partnership with many companies. It's amazing how many companies have come to the table with great ideas on how we can work together.
The company does not say exactly how big its business in respirator masks is, but face masks fall within 3M's personal safety segment, which in turn falls within the company's safety and industrial segment, the largest portion of 3M's business. Safety and industrial accounts for about 1/3 of the company's sales, and personal safety accounts for about 1/3 of that. Gordon Haskett analyst John Inch estimated 3M's face mask business to be about $100 to $150 million before the virus. William Blair analyst Nicholas Hyman estimated sales were as high as $325 million in 2019 and could roughly double to $600 million in 2020. 3M's total sales in 2019 were $32 billion. However, some analysts see in coronavirus an echo of an earlier viral outbreak from nearly 2 decades ago, severe acute respiratory syndrome, or SARS. The division that contained 3M's face mask business at the time was called Safety, Security, and Protective Services. That business grew for several quarters around the time of the SARS outbreak, with a peak of 12% growth in the second quarter of 2003. Incremental margins were also 50% higher year over year. Incremental margins are the percentage profit the company makes for selling each additional unit above the minimum needed to cover the company's fixed costs. How much of a difference face mask sales can make for 3M is a question dividing Wall Street. Melius Research upgraded 3M to a buy on February 26th, saying that while potential economic dangers of coronavirus are impossible to fully predict or understand, this is a problem that affects the entire S&P 500, rather than just industrials companies such as 3M. The company is also undergoing a large-scale restructuring that could yield a recovery in 2021. The simple reality is that 3M is one of only a handful of S&P 500 names that sells a necessary product in virus containment, the report said. This is being ignored by the market. However, some investors figure any benefit face mask sales may bring to 3M's top or bottom lines are likely to be outweighed by declines elsewhere in the business. Even if coronavirus added $300 million to incremental sales of face masks, that would only add to 10 cents or maybe a bit more of earnings per share, which would be dwarfed by the lost business across 3M's other segments, said John Inch, an analyst for Gordon Haskett. But many around the world will likely be grateful to get their hands on those masks.
On this Saturday night, the spat over masks. The U.S. tries to limit exports to Canada.
It would hurt both of our countries.
Will this escalate a health war between two allies? The debate over wearing masks during the COVID-19 crisis.
We need the masks. We don't want other people getting it.
Where scientists stand on the matter. Plus, the care homes left to deal with the dying. And fast-tracking foreign-trained doctors to fight COVID-19.
Global National with Robin Gill.
Good evening and thank you for joining us. Canada is expecting a shipment of surgical face masks to arrive in the next 48 hours. It's a much-needed supply, but what's really in demand is N95 respirator masks. Those are proving to be a bit more challenging to get. President Donald Trump warned manufacturer 3M to stop exporting them to Canada and Latin America. Prime Minister Justin Trudeau says his government is still in talks with the Trump administration about the importance of keeping essential medical supplies flowing across the border in both directions. But as David Aiken reports, Canada isn't planning any retaliatory measures against a longtime ally.
Unlike surgical masks, tight-fitting N95 masks can stop the droplets that may contain the COVID-19 virus, and that makes them a crucial tool for frontline healthcare workers. They're also in short supply, a supply that may get worse after a White House order that a key American manufacturer of N95 masks, that's 3M, must stop exporting them to Canada and Latin America.
We need the masks. We don't want other people getting it.
Canada is now pressing the Trump administration to reverse that call.
We're also continuing to impress upon countries around the world that they are hurting themselves when they limit the flow of essential goods across their borders.
Meanwhile, Canadians are helping keep America safe. For example, 1,500 Canadians from Windsor, Ontario, go to work every day in hospitals and clinics in Detroit, Michigan. In Nanaimo, BC, a mill is working round the clock, turning a special kind of cedar found only in Canada into a pulp that is a crucial ingredient for American makers of protective gear.
Our pulp is going into surgical gowns, masks, drapes, all those kind of good things.
Trudeau does not want to engage in tit-for-tat export bans.
We are not looking at retaliatory measures or measures that are punitive. We know that it is in both of our interests to continue to work collaboratively and cooperatively to keep our citizens safe.
But Ottawa is ramping up domestic industry to produce N95 masks and other gear. And it's also going to global markets. Up to 8 million surgical masks are en route right now from China. And not only that, but the Canadian government has rented a warehouse in China to help with the acquisition of more made-in-China personal protective equipment.
We have been working day and night to source medical supplies for Canadian frontline workers.
And of course, this is one of the great ironies of this crisis. Canada is looking for help from a country, China, with which it has been at odds with for much of the last 2 years, while its best friend and ally next door refuses to help. Robin?
David Aiken in Ottawa. Thanks, David. Trudeau will speak with Trump in the days ahead and will likely point out that Canadian nurses work across the border and Canada has supplied the U.S. with test kits and gloves. The U.S. has the most cases of COVID-19 in the world. More than 8,000 people have died, 1,100 people in the last day alone. There's a global competition among countries to secure what they can to fight this pandemic. Germany accuses the U.S. of swooping in and stealing face masks, which President Trump is now calling on all Americans to wear in public. But Canada's chief medical health officer says right now they must be reserved for the front lines. Jennifer Johnson reports.
The changing face of America in its war against COVID-19. All citizens now being told to wear some kind of protective mask while out in public. The Centers for Disease Control warning that people with no symptoms who talk or even breathe can spread the virus.
There's a greater number of people that are asymptomatically infected than we previously thought.
The new guidelines are in stark contrast to previous recommendations when government leaders and the World Health Organization downplayed the importance of masks. But a 5-year study published Friday in the science journal Nature found that any simple mask blocks 100% of coronavirus droplets and aerosol.
You may generate droplets that are invisible. They're so tiny you can't see them, but they're certainly big enough to carry a virus if you happen to have it in you when you're talking.
Still, Canada's top doctor says they are not ready yet to issue the guideline.
We need to reserve medical masks for healthcare workers. Some of these personal protective equipment is in sort of scarce supply situation, and we need to prioritize people who are looking after the sick.
Adding to the confusion, President Trump is backing the new CDC recommendation, but says he will likely not wear a mask himself, even as he makes this grim prediction.
This will be probably the toughest week between this week and next week, and there'll be a lot of death, unfortunately.
As hospitals across the U.S. continue to battle mask and other equipment shortages, some healthcare workers are comparing their shifts to suicide missions.
This is life or death. Every hospital in the state of New York and across the United States should have the supplies they need.
But finally, some good news for hard-hit New York, the state with the most deaths. It is getting over 1,100 donated ventilators from China and Oregon.
I want this all to be over. It's only gone on for 30 days since our first case. It feels like an entire lifetime.
President Trump has still not ordered all states to institute stay-at-home orders, as a handful hold off. Along with masks, the White House is still strongly encouraging social distancing as America struggles to get this pandemic under control. Jennifer Johnson, Global News, Washington.
This is where things stand with the number of cases here at home. Starting with some good news. So far, 2,500 people who tested positive for COVID-19 have recovered. Unfortunately, more than 230 people have died. Overall, there have been more than 14,000 cases in Canada. And here's a snapshot of how that number breaks down across the country. Nearly 7,000 cases in Quebec. 3,600 cases in Ontario. There are now more than 1,200 cases in BC, and Alberta is reporting more than 1,100. Outbreaks have hit nursing homes and long-term care facilities across the country, posing enormous risks for vulnerable people. In Ontario, some facilities say they're being told not to send seniors to hospital if they're showing symptoms of COVID-19. A document obtained by Global News suggests administrators start preparing families for the worst. Here's Morgan Campbell.
This 65-bed long-term care home in Bobcaygeon is ground zero for a novel coronavirus outbreak, where COVID-19 has killed more than 20 residents. One was Edna Bowers, an 84-year-old woman who died at the home and not in hospital.
They don't play God. Everybody's the same. I don't care if it's a 2-year-old, a 10-year-old, a 20-year-old, middle-aged, elderly, I don't care.
Global News has obtained documentation from health officials sent to long-term care homes saying seniors in nursing homes be kept comfortable if they contract the virus and not taken to hospital. This communication from Quinte Healthcare adds that administrators should sit down with family members to prepare them, saying having this conversation preemptively is very important. It gives families time to digest the information when they are not in a crisis situation, and should an outbreak happen, happen, it is difficult to manage all of the conversations at once. Both the health minister and chief medical officer were unaware of the directives.
But they can be maintained in self-isolation within the home. We'll do that too, but no one is going to be denied access to health care if they need it.
So there's been no directive not to transfer. In that, there's just been some heightened concern if it's from an outbreak facility into the hospital. They would have to treat it accordingly.
Williams says if someone has a do not resuscitate order, they would not be transferred to hospital. But numerous families tell Global News otherwise. One family in southwestern Ontario says their loved one was asked to sign a waiver agreeing to remain at the home.
They would be cared for by the people they're normally cared for, and that this would be a much better situation and comfortable situation for them to stay in their own senior residence.
The director of Pinecrest notes that once she explained both the risk and pain that patients would endure through the intubation process, that no families decided to go that route. Morgan Campbell, Global News.
Quebec accounts for more than half of the confirmed cases in Canada. The province is expecting to get projections next week from health authorities, and that could determine whether more measures are taken to stop the spread. This week on the West Block, Mike Lecouture speaks with Quebec's Deputy Premier about the situation and whether more restrictions are being considered. Mike?
Robin, Quebec has been considered the epicenter of the COVID-19 outbreak in Canada, with a steady rise in the number of cases in recent days. Now, the government says part of the reason is because their spring break was in early March, and the WHO declaration of a global pandemic only came after that. Still, Premier François Legault has imposed some of the toughest measures in an attempt to stop the spread of COVID-19. Earlier this week, they started spot checks at the bridges joining Ottawa to Gatineau, Quebec, to cut down on non-essential visits to the province. The government also announced the closure of grocery stores on Sundays to give workers a break and to not give people another reason to leave their homes. If people ignore public health advice and are seen gathering in large groups, police forces have been told to hand out fines of up to $6,000. The Quebec's deputy premier wouldn't say if more severe sanctions are being considered, hoping people will instead just listen.
For now, we count on our police officers to, like I said, be more severe and don't tolerate any infraction to the national health directives. But I beg people, the last people who still think that it is not a critical situation that we are facing, wake up and follow the rules.
Guilbeault says the law only allows for them to hand out fines. However, last month, a woman who had the virus was arrested in Quebec City for leaving her home because she violated the Public Health Act in the middle of a public health emergency. Robin?
Mike Lecouture in Ottawa. Thanks, Mike. Another cruise ship carrying dozens of Canadian travelers has docked in Florida. But the passengers aren't on dry land just yet. The Coral Princess arrived in Miami this morning with 97 Canadian passengers and 2 Canadian crew members. They won't be allowed to disembark until tomorrow at the earliest. A handful of people on board have tested positive for COVID-19. 2 people have died. The owner of the ship, Princess Cruise Line, says the deceased aren't Canadian, and it's unclear if the deaths are related to the new coronavirus. Global News has learned Ottawa is monitoring 6 other cruise ships still at sea with dozens of Canadians on board. Coming up, the UK records its highest daily death toll due to the new coronavirus. Cars, trains, and ships sounded their horns across China today as part of a 3-minute moment of reflection to honor those who have died from COVID-19. The virus was first detected in Wuhan, China in December. Since then, more than 3,300 people have died across that country. COVID-19 has since spread to nearly every country in the world. The U.S. is now the worst hit, followed closely by several European nations. There are some signs of hope now in Spain and Italy, where the rate of COVID-19 infections and deaths is slowing. But places like France and the UK are still bracing for the worst of the pandemic. Redmond Shannon reports.
A month into its lockdown, and Italy is still gripped by the pandemic. Life is nowhere near getting back to normal. 11,000 medical professionals are among those infected, and 73 doctors alone have died. The head of Italy's doctors' union says medics are going through unbearable stress. He says the infection rate is due to poor public health information in the early stages of the Italian outbreak. The overall infection rate is slowing, but only gradually. And the same may be happening in Spain, despite another horrific daily death toll of 809.
Siguiendo las recomendaciones de los expertos.
Spain's Prime Minister Pedro Sánchez has extended the lockdown until at least April 25th. But there are stories of hope amid the sadness. A mother and daughter, both hospitalised weeks ago, now finally reunited in the same ward to recover together. The UK has now recorded its highest daily death toll at 708, now just behind Spain, as this temporary 4,000-bed hospital in London accepts its first patients. Parts of Britain are expecting temperatures in the 20s on Sunday, and it's feared that many people will go out and try and break those lockdown rules.
Whatever the temptations this weekend, please don't go outside to visit the lakes, the beaches, the countryside. Take pride instead in keeping your own families and communities safe.
But in Sweden, the strategy is very different. Schools, parks and bars are open, with trust placed in citizens to do what they can.
Considering the logic the authorities is explaining, that we're not thinking that we can stop the virus, but rather flattening the curve, as they say. I think it's right to do less strict regulations and sustain them for a longer period of time.
Scientists are divided on Sweden's policy, but it's certainly a politically brave move given the strict lockdowns across most of the continent. Redmond Shannon, Global News, London.
Close to 1.2 million people have been infected in about 170 countries, but there's a handful of isolated countries untouched by the pandemic. According to data from Johns Hopkins University, 18 countries have not reported a single case of COVID-19. Many of them are remote islands in the South Pacific like Samoa, Tonga and Vanuatu. But there's concern some countries on the list like North Korea and Yemen likely have unreported cases. Still ahead, the plan to use internationally trained doctors to address the shortage of help in the COVID crisis in Canada. COVID-19 patients are being treated in hospitals across the country, but there is concern this may only be the beginning. As Mike Droulet explains, that's why some provinces are now considering allowing doctors and nurses trained abroad to join the frontline fight here in Canada.
COVID-19 has spurred a rush to build makeshift hospitals across the country. It's less for the thousands of cases overloading the system now as it is in anticipation of what is to come.
We are preparing ourselves in the next 2 to 3 weeks for a peak.
Like most physicians, Dr. Shabana Sikander sees a system in need to monitor COVID cases in isolation and support overworked hospital staff. It's why Ontario and BC are looking to create positions for foreign-trained healthcare workers.
I'm just thinking that why can't we work on prevention rather than waiting for the peak? Why can't we flatten the curve now?
In Ontario, 1 in 10 confirmed COVID-19 cases is someone who works in healthcare. And in Ontario alone, there are 13,000 doctors and 6,000 nurses who are educated elsewhere and are not doing what they were trained to do. But the province's program is strict. While few have applied because it hasn't been advertised, only 10 in 12 applications have been accepted, leading to the provincial opposition to call for requirements to be relaxed.
When you have between physicians and nurses close to 20,000 individuals, from what I understand, who've got credentials from other parts of the world, I just don't understand why we wouldn't collectively want to be able to get them onto the front lines to help.
But there's also this: how many will accept the risk of working in a COVID-19 positive setting? Even if BC creates an associate physician class, is there enough incentive to get people to apply?
A big problem is that
It sounds like that it's temporary. We are thinking maybe some kind of pathway that leads to provisional licensure, conditional licensure, which ultimately leads to full licensure. Something like this.
That could take time to figure out, something the healthcare system has in short supply. Mike Drolet, Global News, Toronto.
Up next, missing school but trying to stick to the curriculum. This jockey just watched himself lose the first ever virtual Grand National. Britain's annual horse race took on a lockdown-friendly format this year. 40 computer-generated riders and horses competed, with an algorithm placing Potter's Corner in first place. All profits from the betting are being donated to the National Health Service. COVID-19 has dramatically changed the way we live, work, and learn. By now, most Canadian students would have been back in the classroom now that spring break is over. But the pandemic has forced schools to remain closed. Instead, thousands of students are now getting their education online. After a downer of a spring break, Sienna Boxer was ready to get back to school, except it's still closed.
I was really excited and I really wanted to see my friends, my classmates, and some of my teachers.
The 12-year-old joins thousands of Canadian students now taking their classes online, but she's worried about being distracted at home.
I haven't really been able to focus a lot with a different environment. I think it's much easier because you don't get as distracted in a classroom. And as at home, I have all of my fun things.
All across the country, classrooms are empty, forcing teachers to rejig the curriculum with virtual classes.
Definitely different, but doable. But everything has to be done very small steps to not overwhelm the parents who are also now struggling and the children at home.
There will certainly be challenges. There may not be enough computers to go around the household now that parents are working from home. There isn't an exact system for grading either.
If online learning is the only way, it's problematic, and when it's attached to grading practices that are not going to allow all students to demonstrate their learning.
But experts say bringing down the walls of a classroom can benefit teachers by showing them new ways to teach.
I can use any object that I have next to me and I can give you a whole math lesson with it. So just randomly, absolutely randomly, I have this in my head. You can see it's the tissue box. And I can teach you a lot about the volume, about measurement, about density, about a lot of things, but you have to be creative.
Sienna is ready to get back to learning.
I think I will end up being prepared, but maybe not as prepared as if I was going to school regularly.
She has the maturity to understand this isn't a normal situation because all of her friends are in the same learning boat. And that is Global National for this Saturday. I'm Robin Gill. We leave you tonight with the power of music. A Vancouver musician organized this virtual choir with 150 singers from 27 cities around the world. Their rendition managed to raise $2,000 for BC Women's Hospital and Food Banks Canada. Thank you for watching. I'll see you back here tomorrow. Good night.